Now talk about the AKI. Okay, AKI being, if you see the CKD, that's chronic kidney disease. AKI being the acute kidney injury. So in medicine, once you hear anything acute, it happens within a short time. Once you hear it chronic, it happened after some time. Okay. So acute kidney injury is what we are going to discuss. Okay. So what is acute kidney injury? It's just a sudden, like all of a sudden, the way your kidney was functioning, taking out urine, taking out waste product, is just decreased. And this whole issue, you can just trace it back to a few hours ago or few days ago. So it's acute. So it leads to what? Functions of the kidneys are going down. So the waste that the kidney was taking out is not being taken out again. So there's waste buildup. The fluid that the kidney was taking out in urine is not being taken out. So you have buildup of fluid back in the body. Do you understand? So it's often reversible, if you treat it ASAP, you know. So what is AKI? It's a rapid loss of kidney function. It was previously called acute renal failure. Okay, so it typically begins within 48 to 7 days, 48 hours to 7 days. 48 hours is 2 hours. So any kidney issue that you're just tracing it back to just one day is acute. You know. No, 7 days, guy. You're tracing it back to 7 days. It's acute. That's 1 week. Do you understand? Person has not had any issue before. This is the first time they are having it. So this is just a grading. I can see that from acute kidney injury, it becomes acute kidney disease. It becomes chronic kidney disease. This one is easily reversible. That's the one we're discussing. You know, if you just take good water, you stop maybe what was assaulting the kidney, you know, you reverse it. So it's classified into three stages. We have the ones that could be pre-renal. Pre-renal simply means what? These blood vessels bringing blood to the kidney. The issue is before the blood vessels. So the issue is primarily what? The amount of blood coming to the kidney is reduced. Do you understand? So it can be associated with different things. The person has not taken water for a long time, blood loss, heart failure, heart attack. Then we have intrinsic or renal. This one, the issue is within the kidney. Are you getting? We have the other one, post-renal. So you see this ureter carrying urine away from the kidney down to the bladder. If the issue occurs there, you see the issue is after the kidney, so it is post-renal. Okay, so let's talk about the intrinsic or the renal that's inside the kidney. It could be that the glomerulus have been inflamed. It could be that there's sepsis, there's spread of bacterial infections in the blood. So the blood filters into the kidney and it got into the kidney and there's infection of the kidney. It could be lupus erythematosus. It could be that it took out some drugs. So the liver detoxified these drugs. So for the kidney to excrete these drugs were so toxic that it hurt some tissues of the kidney. It could be rhabdomyolysis, a lot of toxins. The liver broke down some of it, but didn't break down properly, and the kidney has to excrete. And there's issues with the kidney tissues. So back to the last one that I told you guys, you can have issues after. See, note this classification. It's a very common exam question in chemical pathology. So the artery bringing blood to the kidney, if the issue occurs there, before the pre-renal, if the issue occurs inside the kidney, intrinsic or renal, if the issue occurs after the kidney, that's in the ureter, down, that's post-renal. You get it? In fact, if they teach you anything acute kidney injury, there are two questions. They always tell you about the classification. That's all those DIGO classifications. We'll talk about all of that as stagings. But the most basic stuff they can ask you is this, like this classification based on site of occurrence of the injuries. So after the kidney, You can have kidney stones, you can have enlarged prostate, you can have tumors, you can have blood clots. So symptoms is there's reduced urine output or no urine at all, swellings in the legs and ankles because those fluids were supposed to be put out of the body. As they are not put out of the body, they are actually what? Accumulating in your body compartments. That's edema. Shortness on breath because there's accumulation of fluid. You are weak, you are confused, you feel like you want to vomit, okay? Chest pains and pressure. Okay. So you diagnose it from you are trying to measure, okay, this kidney was doing so work, was taking this waste out of the body. But all of a sudden the kidney is not taking this waste out of the body. So let me measure how much of this waste is left back in the body. So you measure for creatinine, blood urea, electrolytes, urine test, urine output, and urinalysis to check out for proteins in urine, bacteria in urine, blood in urine, that's hematuria. The imaging is where you try to look at the anatomy of the kidney and see if there's any distortion. Then if you are suspecting for cancer, of course, you go for biopsy. So treatment is always try. There are 100 things that could cause the kidney injury. You have to identify it. If you don't identify what is causing issues to the kidney, you just be treating based on assumptions, which is not nice. The intravenous fluid, electrolyte correction, blood pressure management. If you are dealing with a hypertensive patient, in dialysis, if the kidneys are almost shutting down, you have to go to dialysis quick to put out some waste so that you reduce the load on the kidney, so that it will make it to come back faster. So I think this is pretty what we have on AKIs.